My name is Syed Sayeed. I have been to Gaza before on 2 occasions. This occasion I came here with Pama, and each experience has been unique and challenging. The challenges have been persistent throughout, but even coming for the 3rd time, there are unique challenges here. There are medical challenges, there's strategic challenges, and there's also administrative challenges. And for the strategic and administrative challenges, I've relied on Pama's expertise in the area in planning these missions to be comfortable coming to this area. The most difficult situation right now for plastic surgery is taking care of patients with very large burns. Before October, the system here was able to deal with large burns and they had a very good success rate. But ever since October, patients with burns over 30 and 40% really don't survive, especially children. So taking care of these patients is very difficult. Their death is slow, it's very agonizing for them, and it's difficult to treat them medically, it's difficult to treat them surgically with success. We've done a number of operations here that have been from small operations such as dressing changes to larger operations that include flaps for lower extremity reconstruction. Yesterday, we did a combined case with oral maxillofacial. Another team member who came on the same mission as a maxillofacial reconstructive surgeon. And together we were able to provide the patient with a multidisciplinary approach in a situation of acute trauma, where there was missing bone and missing soft tissue after a blast injury related to shrapnel. The patient was missing part of the mandible, a large portion of the chin, and a large portion of the lower lip. With the maxillofacial team, we were able to stabilize the bone with a large fixation plate, and the plastic surgical team assisted in reconstructing with a number of local flaps in order to close the wound. Coming this time after the ceasefire, when much of the population had moved from the south back to the north to find their homes and settle again, now we're seeing the increased bombardments and the new evacuation orders pushing people back to the south where they're going and they have no place to go. So there are people going and there are people who are going and coming back because they're not finding a place to stay. And the sites that we're seeing, even a few days ago when we arrived here, there were a number of tents and there was a lot of crowding. But even in the last few days and even overnight periods, we see large amounts of people leaving the area, crowding on top of anything that's moving to try to get their belongings and their loved ones and families to the south to find someplace to be. Each time I've been here, and now also, the only thing that I feel as the mission comes to an end is that the feeling of not wanting to leave, the feeling of wanting to stay, the feeling that my mission here is not complete, and thinking about how I can come back again to serve. I wish for the people of Gaza that they are free from what is going on, that they're able to regain their sense of self, their sense of health, the ability to move around, at least within Gaza, with some freedom, without worrying about their health, without worrying about being bombed, without worrying about where their next meal will come from.